I'm Jeffrey Pease from Message Mechanics, and I get to be here today with Christine Viera, who is Chief Marketing Officer of TouchSource. And we've worked, hi! And we've worked together before.
Many long, good years ago.
Yeah. So tell me, Christine, what is TouchSource?
So TouchSmart supplies digital content, displays, and kiosks for commercial real estate companies, healthcare, education, and government. It helps them display critical information to get people, mostly visitors and tenants, where they're going. Includes wayfinding and also a lot of messaging content. These days, a lot of public health messaging content on how to maintain safe social distancing and to let people know the latest news on what are good practices.
Oh, fantastic. Now, that kind of naturally leads to my next question that I'm asking everybody, which is, how has your business been changed or impacted by the current crisis?
Yeah, I think we've all been changed in so many ways. At TouchSource, what we've done is really pivot our focus to just enabling customers to rally through what has been some fairly unusual times. Property managers have been, by and large, on the front lines of needing to keep things open, keep buildings and people in them safe, during, through the pandemic, and especially now as we're reopening. So a lot of how we've changed is to make sure we're just spending more time enabling customers to put the right messaging on their digital displays, put messaging boards up, help them put in place solutions around density management, scheduling people so that there's not too many people in a space. And so a lot of our work has been really help counsel them on how to do that, how to keep displays clean. And, we've done things like use our excess inventory to equip huddles with new digital signage to really enable patients to know what to do, where to go, all while protecting safe social distancing from staff that are keeping all of our public spaces open.
And I think that you mentioned before we turn the camera on that you've actually been providing these digital signs to the hospitals without charge. Is that correct?
Yeah, so one of the things we wanted to do, because this has been so hard on our public health professionals, hospitals, nurses, doctors, the ownership and the CEO of the company felt really strongly that we need to take our products, our services, and just be in it with people. So, all the displays that we had that, were in our excess inventory, we made available. So we announced it to customers, but also just prospects, and had a number of folks contact us and say, great, I need it. We got to tell people where to go and how to do, how to engage with us safely, because a lot of people who are visiting, whether it's doctors' offices or even emergency care facilities, they're compromised immune systems. So they need to still be safe even while going in for healthcare. So we've been excited to do that and make sure that we've got, we did everything from provide that to orchestrate the installation of that with some key partners of ours. So it was really just heartwarming to see everyone jump on the opportunity to help, these great institutions that are really serving all of us.
And I think you also told me earlier that you did something that maybe was a little bit of an unusual move, which is that you put warranties on signage that you're giving away for free.
Yeah, of course. I mean, the way we think about it is these are really important institutions. We want them to have a great experience. Of course, we're going to warranty our products with them. And if there's any issues, the last thing we want to, have those hospitals, and frontline facilities experience is a bad service experience. I mean, the customer experience is number one for us all the time. It doesn't, giving away free stuff doesn't change that at all. In fact, our team was really proud to do it. And so, that's just been really energizing for our entire company and our employees. Our CEO has kept us all together throughout this crisis. And if anything, we're all pivoting to being on the phone with all of our customers, including the healthcare professionals, to check in, make sure people are okay, make sure that if there's any service needs, we were taking care of it. And really just, being there as a voice to give them ideas on how to, during tough times, leverage the tools that we provide to solve for it. So, that's been something that has really rallied the company.
Yeah, and that kind of enthusiasm, I mean, the goodwill it earns outside, but also what it catalyzes inside is really important. I've been talking with a lot of companies about this idea that right now helping is the new selling. Like this is earning brand equity that's going to define a company for years.
Yeah, and I think, so you and I have known for a long time that, being, companies that provide thoughtful advice, counsel, information has always been a great way to earn the trust of others, especially right now doing that with empathy, making sure the first thing we do is check in with people. It's just so important because we just sell to people. I mean, that's really what, business to business is, how do I help you solve a problem you have? And to do that well, you just gotta ride the roller coaster with people sometimes. And I think that's a lot of what we're seeing right now is, we do a lot of calls just to check in. Sometimes we can help people immediately with whether it's a service request. Sometimes, they want a warranty to extend the life of their product. And we're offering extra terms right now because people just want to not have to spend money that they don't need to spend. And we want to support them because we're all trying to get through the COVID and pivot. And we just want to be that partner for our customers. So it's great to work for a company that really values that.